I love everything about spine surgery. I really do. There's not like one thing that I say, I just want to do more of this and more of that. What I really like about spine surgery is we can do so many different types of procedures, so many different types of pathology that we address. And probably my favorite thing is integrating the new technology that we're involved in developing in the future of spine surgery and being on the front line, the frontiers of the future technology, and incorporating that with improving our patients' outcomes. We're looking at our data regularly, seeing how can we do better? How can we get our patient up and going, pain-free, restoring their function in a quicker fashion than we ever have in the past? And even just over the past 10 years, we've made significant strides in how we treat our patients. Right? So some surgeries we were doing, they were in the hospital for days. And now, doing the same exact operation just 10 years ago, it's done at an outpatient facility and they go home a couple hours later. It is remarkable. It's really exciting. Yeah, I love the technology and how it's changing healthcare and the way we deliver healthcare at such a rapid pace. Even this weekend, for example, my partners and I all flew out together to San Diego to do a course and train together, a combination of spine surgeons and interventional pain management specialists, to learn new technology. And now we can take that and apply it to our patients to improve their outcomes. Honestly, as I said before, I love everything about spine surgery and all different types of surgery. But my biggest passion right now, as I've been practicing for the past 10 years and evolving, is certainly minimally invasive surgery. And why minimally invasive? Because it's transformed the way we take care of patients. It's transformed the way patients go about their daily life after surgery. When you can do a lumbar fusion through 2 incisions that are less than 1 inch long, and it takes an hour, hour and a half to do the entire surgery, and they go home a couple hours later and they're up and walking right away, they're walking out of the facility, that's powerful. I mean, I have patients that are in their 70s that are walking a mile a day within the first 2 weeks after a lumbar fusion. And patients even say to me, I can't believe I'm doing this. I say, well, I see it all the time. But that's pretty powerful. The other transformative type of surgery that I've seen, not necessarily a surgery, but more of a procedure, is a kyphoplasty. That's really changed the way our patients heal. 30 years ago, 20 years ago, patients would be in a hospital, lying in bed, miserable because they have a broken bone, right? They don't get up, then they undergo a surgery to do a kyphoplasty, or even worse, they have to have a fusion, and their outcomes are not good, they're not able to mobilize, and they deteriorate rapidly, especially our elderly patients. The kyphoplasties really evolved the way how these patients are cared for, and now, without being put to sleep, just with minimal sedation or just local anesthesia, we can take care of them in 10 minutes in the office by simply injecting like a bone glue into the broken bone. And immediately they feel stronger, they feel more stable, and they have pain relief. So I mean, I can tell you about patients that are writhing in pain and just miserable, and they're scared of surgery. They are terrified because they've been told that don't do it by their friends and family members. And they finally get to the point where, despite being in severe pain, they say, I'm going to do it. And they get the courage to do it. And then immediately afterwards, they're crying, not because they're in pain, but because they're so happy because the pain is gone. And that's rewarding. They say, thank you, doctor. I wish I made that decision earlier. And it's exciting every day to see that. I have other situations where patients have had major deformities, could barely walk. And then they're standing up straight again. And they come up to me and say, look at me, doc, I can stand straight. I haven't been able to do this in years. And that puts a smile on your face. And probably the most touching type of story is someone who's going paralyzed or having a major neurologic deficit. And when you see someone coming in a wheelchair, and the next time they come in and they're walking, that's powerful. And I get asked all the time, what drives you? People say to me all the time, you're the hardest working person I've ever seen. What drives you? And it's 2 things: my family, my kids, my wife, and my patients. I love it. They're excited. Every time I come into work, I get hugs. It's exciting, and that's what drives me every day.